The neurologist said it's just migraines. Her MRI, it showed an old stroke and vascular damage in her brain. She's 66, dizzy, off balance, and nobody told her. This woman found me on TikTok. She complained of headaches, dizziness, vertigo, ringing in her ears, balance problems, and just this overall feeling that her health and quality of life were tanking. She was convinced she needed an upper cervical chiropractor. Before I even thought about scheduling her, I asked her one simple question. Have you had any imaging done? She said, yes, I had a brain MRI, but they told me it was fine, just migraines. She emailed me the report. I sat down, read every line, and here's what it actually said. Chronic small right superior cerebellar infarct. That's an old stroke in the balance and coordination center of the brain. Periventricular and subcortical white matter hyperintensities compatible with small vessel ischemic changes. Chronic small vessel disease that we know is linked to balance issues and future stroke risk. So we've got a 66-year-old with dizziness, vertigo, balance deficits, tinnitus, headaches, and documented vascular brain changes. And she was told, nothing's wrong, it's just migraines. Why this matters? Cerebellar and posterior circulation strokes are notoriously misdiagnosed, especially when the main symptoms are vertigo, dizziness, and headaches. This is exactly why just slapping a migraine label on someone without really reading the imaging report is very dangerous. Vertigo, imbalance, and gait changes after a cerebellar stroke are common and can wreck someone's independence if we miss them. She didn't need a neck adjustment first. She needed her brain and her blood vessels taken seriously. As a chiropractor, I don't just crack joints. Every week, I see serious medical findings on x-rays, MRIs, and other imaging that were never explained to the patient. My rule is simple. Listen to the whole story. Review all imaging and reports line by line, not just the impressions. Decide if you're safe for chiropractic care after you understand the total picture and not before. In her case, that meant no upper cervical manipulation, referral back for stroke risk management, and possible vestibular rehab, not another migraine pill. If you're dealing with headaches, dizziness, vertigo, balance problems, especially later in life, do not settle for the everything's fine diagnosis if you've never truly had your imaging reviewed. If you've had an MRI, X-ray, or other imaging and still feel lost, you can request your reports and have another provider go through them for you. If you're in my world, I'm happy to review your imaging before we ever talk about treatment. Find a provider who listens, reads the entire report, and looks at the totality of evidence available, not someone who rushes into a diagnosis or a treatment plan in 5 minutes.